Hello, I am Lena Peak. I use she, her, and they, them pronouns, and this is Sexual Health and Relationship Education for Adults with Disabilities for the Masters in Johnson Sexuality Symposium, which is sponsored by the Sexual Health and Education Specialization of Washington University in St. Louis's Brown School of Social Work. The symposium is not intended for audiences under the age of 18 due to the discussion of sex and sexuality. First of all, I want to thank you all for tuning in to my brief presentation today. I want to do a quick introduction of myself. Again, my name is Lena Peak, and I'm a first-year Master of Social Work student at Washington University's Brown School, and I'm concentrating in sexual health and education. I currently serve as a practicum student at ASPPIRE of Mid-Michigan, which is a nonprofit that provides programs and services to adults with disabilities, many of whom are on the autism spectrum. Services include social coaching and employment skills, among others, and I serve as a facilitator and curriculum developer for Aspire's Sexual Health and Relationship Education program, which we call our SHARE program. And this program will be the focus of my presentation today. So before we dive into, SHARE and the work that I do, I want to talk about this intersection of disability and sexuality and why it's important. At a very basic level, first of all, the World Health Organization recognizes that people are entitled to certain sexual rights, but research shows that intellectually disabled adults, which you'll see referred to as ID adults throughout this presentation, are often restricted from sexual expression and having intimate relationships. So maybe some of the reasons that we see this happening is assumptions of asexuality among this community, assumptions of innocence, and assumptions of being vulnerable to abuse. And there is some truth to that. ID individuals are sexually assaulted at a rate of 7 times more than that of non-disabled individuals. Approximately 80% of women and 30% of men with developmental disabilities will have been sexually assaulted. Half of these women have been assaulted more than 10 times. So these statistics are clearly very disturbing and startling, and we can see why there is an assumption of vulnerability. But combined with other factors, it's often the lack of proper sex education that makes ID adults more vulnerable to sexual abuse and exploitation, as well as more vulnerable to accusations of sexual assault and harassment for not understanding social and sexual norms. So this brings us to the work that ASPIRE is doing. So ASPIRE, it's not spelled wrong, or it's intentionally spelled wrong. It stands for Adaptive Social Program Providing Instruction, Recreation, and Enrichment. And we have a Share 1 and Share 2 program. Our Share 1 program talks about sexual health, anatomy, and reproduction. Share 2 focuses on relationships and intimacy, and we're going to dive into those specifics a little bit later. These are 12-week programs, and all of our participants are over the age of 18 and have a disability. The majority of our participants are autistic. We're committed to having really small groups to make sure that our folks feel comfortable sharing and asking questions. We also always have 2 facilitators for our SHARE programs. And our curriculum and materials were developed by ASPIRE staff in collaboration with disability scholars. So ASPIRE had an opportunity to partner with some really wonderful researchers from Michigan State University and the University of Hawaii to conduct a community-based participatory research project. So here at the Brown School, we talk a lot about evidence-based practice and practice-informed research. And this process was really a perfect example of both of those things. So the study focused on our Share 1 program, which at the time was our only sexuality education program. And it really strived to answer what further questions our participants had so that ASPIRE could determine how to improve the program to really meet the needs of our community. So the way the study was conducted was through qualitative data that was collected via anonymous note card questions that were written by our participants after each session. And the facilitators would then address these questions at the next group meeting. So some of the questions we can see here are, burning question: is it right to date someone who is 10 years younger or older than you? Can you force a friendship to become a romantic relationship? Does sex need to be central to a relationship, etc.? So these were some of the things that maybe they weren't getting out of just the basic fundamental sex education that we were initially providing, that was talking about, biology and reproduction. So through this research, two major themes emerged, one of them being authentic relationship experiences. So these were questions that were related to relationships and self-advocacy, and we had a few sub-themes that emerged. So one of them being social norms. So, what are the rules of texting? Is it right to date someone who's 10 years older or younger than you? Next, we have sexual behaviors outside of intercourse. So questions like, is it okay to masturbate while in a relationship? And then lastly, we have communication within relationships. So when do you know when it's the right time in a relationship to start having sex? And then lastly, we had some questions that were pertained to individual sexual health, which were questions regarding health and hygiene or biology and reproduction. So the need for Share 2 emerged through these study results, and that's kind of where I come in. My role with Aspire has been adapting the curriculum for virtual instruction because of COVID, and also updating the content as necessary based on new techniques and information that I'm learning through my classes at the Brown School and also through my ASECT supervision. And for those of you who don't know, ASECT is the American Association for Sexuality Educators, Counselors, and Therapists. In addition to the curriculum development, I also serve as the co-facilitator for this program. So as you can see on the slide, this kind of outlines the topics for our 12 weeks. And, we have some flexibility based on our group needs and questions that may arise of how we kind of go about planning our curriculum. So Aspire's goals for the future with this program are really making it into a 4-part program. So Share 1 through 3, as we see, would be ideally taken consecutively. So Share 1 would be sexual health and anatomy. Share 2 would be the relationship and intimacy component. And then Share 3 would be an in-depth dating and community outings program. So taking our participants out into the community, teaching them, how to order at restaurants and how to pay for meals and those, very basic skills that they'll need to have when they start dating in the real world. And then lastly, our Share 4, which would kind of be a standalone program, would be sexual harassment in the workplace. So our eventual goal would be to publish this program and hold professional development training for other professionals in the disability field. So like any new program, we've come across some barriers and hit a few road bumps along the way, and we're still learning. Many nonprofits understand the struggle of balancing community needs with bringing in revenue, and Aspire is certainly not immune to those struggles. So for that reason, we can't guarantee that Share will be offered each session, with the demand or the availability of facilitators. And we also can't guarantee that participants will take Share 1 and Share 2 consecutively if we're not able to regularly offer the program. So there's also a lot of neurodiversity among our participants, and ideally we would like to group similar skill levels together to ensure appropriate and individualized instruction. But, because of, various interest levels and what we're able to offer, this just isn't always feasible. So that makes facilitators' jobs a little bit trickier, making sure that we're able to meet participants where they're at, even if their skills are vastly different from other skill levels in the group. And also, our director feels very strongly about offering share, and for that reason, we worry about the sustainability of the program because we try to offer it as frequently as possible, and because we're committed to having 2 facilitators and small groups to ensure that our participants are comfortable sharing and asking questions. This typically leads to a revenue loss. But again, we continue offering it because our director especially feels that it is so important for our participants to learn. Lastly, this is kind of a new road bump that we're experiencing along with many others in this field, I'm sure, and that is virtual instruction due to COVID. So many of our participants already have a tough time with social cues and norms, and being virtual makes it even more difficult to read body language and facial expressions. So that kind of adds another layer of social challenges there. There's also some pros and cons of being virtual. A pro being that it removes the transportation barrier that a lot of folks with disabilities have. And then the con is that it adds a technology barrier. So, people need to have access to technology and also need to understand how to use it or have somebody in their lives that can help them use that technology in order to participate in our program. So a few suggestions that I have for future practice. First and foremost, we must acknowledge that intellectually disabled individuals, they have sexuality and desire. And disability professionals need to work very closely with sexuality educators and vice versa. Educators that are working with ID populations need to be very intentional about creating an open and safe environment for students to ask questions. So 2 suggestions from our researchers who studied our Share One program are that high school sex education programs need to be inclusive of ID students, and also that sex education should be embedded into transition programs for ID adults to discuss those, more nuanced and complex ideas that maybe go beyond a high school sex education program. Lastly, I would urge that disability organizations and agencies should have less restrictive policies regarding ID individuals' sexual expression and relationships. Part of creating that culture would be having staff trainings on sexuality, ensuring that our participants and clients have access to sexuality education, and also encouraging and providing social opportunities within and outside of the disability community to make sure that we are fostering the social and sexual development of our participants, in ethical and healthy ways. So lastly, here are some ways that you can keep up with Aspire. You can visit us at our website and sign up on our newsletter. You can find us on Facebook and Instagram at ASPPIRE of Mid-Michigan. I've also included my contact information here and the title of the research project that was conducted in case you want to go on and read that on your own time. So thank you all for tuning in to my presentation. I hope that you're able to take some of this information and apply it to your own practice. Again, please don't hesitate to reach out to me via email with any questions or concerns. Thank you so much.